right, now it's 11:01. We warmed the room up in a very casual way. I want to welcome you to the session. My name is Nika Smith. I serve my day job. I'm Vice President for Academic Affairs for Maine Health and my office. I have an office in Portland and one in Scarborough. I was born on MDI and originally from Rockport, Maine, so a Mainer. And I think you'll see some of this come throughout our presentation. Kelly, do you want to grab the mic and introduce yourself so they'll know who we are from the beginning?
I'm Callie Varaklis. I am also from Maine Health. I am the DIO at Maine Health, which means that I oversee all of the residency and fellowship training programs. I'm an OBGYN by training, and I am the PI on the MERGE collaborative project, which we'll talk about in about 14 minutes.
Great. Okay, I'm the PA on the Building Maine Network grant. So it's US CDC dollars funded through Maine DHHS through a competitive grant process. So I'm going to walk you through the grant. We also have two program managers. We each work with a program manager very closely. So Meredith Bullard in the back here, and Dave McClellan, who's trying to recruit more participants from the hallway, are here as well. So if you have questions, they also know a lot about this work. So this grant, we were applied almost 2 years ago now. We've been funded a little bit over a year, and there are 5 main parts. So the bottom line, what we're trying to do is really from the graphic, get people from the training programs that exist in communities, whether that exists and people are employed or they're not employed, if they're at a community college or a college system, into clinical training sites in rural and underserved communities in Maine. The types of trainees that are included are all of them. So we wrote a list, and that's what we applied for, but it really is all disciplines, and the academic partners are all of them. So all academic partners, all clinical training sites, or sites that are providing healthcare that aren't yet clinical training sites for a particular discipline can become part of this work. So it's all inclusive. We're not quite singing Kumbaya, but we want as many people to be involved that want to be involved. So the goal, as I already said, looking at rural and underserved communities in Maine. So partners, those in the salmon color at the top there, were the original entities that were writing for the grant. Actually, the University of New England came to Maine Health and said, we think you should write for this. And we said, we don't think we should write for this. We think this should be a partnership. The needs are statewide. We went to our new CEO, because we had to say, are we in competition or are we in partnership? And he was very forward thinking and said, we are not in competition. We are partners. Let's compete at the higher point and not at the education point. And so we looked at this as a statewide initiative. There were some specific subrecipients written into the grant, but really partners that exist and more that we want. You'll notice long-term care is a particular area that we need more partners at the table. So if you represent that group, we would love to talk with you. And we continue to grow and evolve. So part of the session was about ecosystems. So the current ecosystem, there are different players here. We have students, we have employers, we have preceptors, we have academic institutions. And so I want you to think about this, and some of you know this, but maybe haven't thought about it in a while. If you are either the academic training institution or you are the trainee, the current ecosystem, generally speaking, is I, as the academic institution, or myself as the trainee, call around to anybody I can figure out or send emails and look on websites, and I'm going to send everybody an email because I don't get either my students out, or as a trainee, I don't get to graduate if I don't get certain rotations of certain durations and certain disciplines done. And so I would call this chaotic. And some schools do this really, really, really well, but they struggle every single day and they invest resources to do this. And some students do it well and some shouldn't be doing it at all, like it's against the program policies to be doing this. And they do it anyway because the stakes are really high. And so when stakes are high, people do whatever it takes to be successful. And so we have a system that is chaotic at best. And if you think about it from the other side of the equation, either the institution being asked or the person being asked to take this learner, how do you say yes and actually get them in and follow all of your institution's rules? Like, where do they get a badge? How do I know if they've had the right vaccines? How do they know where to park? So like logistical things. And then what do I do if I actually want to say no? This is my next door neighbor and I really know this person and I don't want to spend 6 weeks with this person. And so, but I think we could train this person, but with somebody else in my organization, but I don't even know how to make that work. And so we have this chaotic system. So what we were proposing is to look at it a little bit differently. And we've had some successes and challenges, so I'll just give you that on the front end, was to put in the center a network, so a coordinating council and a network where everybody is invited to help figure out how to make this work better. We have some funding through Maine Health and through Northern Light and the Maine Hospital Association are the 3 entities to help filter money to communities. Doing a couple of different things, Preceptor training and matching, and also a platform to connect people. So I'm going to talk about 5 strategies. I'm going to talk about 3. I'm going to present 3 and talk about them, and then I'll come back and present the other 2. Okay? So the network is a little bit what I was talking about. Everybody's welcome. Everybody can participate. We put in some regional management, which were the 3 entities that I had listed there. The second, which is a deliverable, is a common preceptor development program. I'm going to talk about it. This is the one space where Dr. Varaklis's work, where our work overlaps. And so I'm going to introduce it and she'll continue to present it because it fits in both of our work. An e-matching platform, which the state didn't really say this is why they funded this work, but I think deep down this is why this work got funded. And this has produced the most challenge. And if you think about things in life that are easy to fix, they would have already been fixed. And so this one we are working on every single day, and we've had some successes and challenges, and I'll share those with you. And so let me walk into each of these. So I Help Maine is a learning platform. It exists. It was launched last year. It is to tie existing resources in an orderly fashion that are available across multiple disciplines. When we started this work, we identified by looking at the published competencies of over 20 healthcare disciplines that they all summarize down into 7 domains. So it's nationally been published in a certain language, but when you put them all together, it's about 7. And this was the foundation from which we built the platform. And so here they are listed. I will leave this for you to continue to present more on this, but I find this very interesting. So regardless of where you enter organizationally, you could enter as into an entry-level position, a middle position, and a provider position, that there are elements already in place. And what we did is we went out and identified, curated existing resources. So this wasn't about making a lot of resources that were new, it was about putting them in an organized fashion. So we have some resources here. They're kind of in 3 different headers. If you look, teaching and learning, resources for critical healthcare issues in rural Maine, and then DEI. So I'm going to jump to the learning platform. So there is a learning platform. How many of you have used CCPS, which is used, or you know about it, that's used extensively for placement of nursing students? Can you raise your hands so other people know that I'm not the only one? Okay, so we have some people in the room. This is an existing program. It's developed by Massachusetts and used in multiple New England states to place students, so that chaotic component of how students get placed. I'm not saying it's perfect in nursing at all, but they do have a uniform platform. There are multiple clinical and academic partners that use this, and when we wrote this grant, we said the first step would be to pick a matching platform, and we just assumed that it would be this platform, and in fact, this platform was selected. So the goal is to have a more logical matching mechanism between academic program or student and their clinical site. This has proven a little bit challenging. So we have kept the strategy that we need a central matching platform. Our goal had been to take the CCPS platform and expand it from nursing only to multiple other disciplines. What we found is a couple of things. And some of this we knew when we wrote the application, and then it's become clearer over time, that there are some clinical sites that have very few placements. So to buy into a system economically doesn't really make a lot of sense. If you're only going to take 3 or 5 learners next year, the cost per placement is pretty high for the matching platform. The other is the staff that run, that in each location that's responsible on the clinical side for the matching platform, they're almost all the nursing side of the house, because we tend to take lots of nursing students across the state. If you ask them can you do this with physician assistants or physical therapists or other disciplines, it's the same staff. There isn't another staffing unit within the clinical site that's going to run this. So that actually we thought would be to our advantage, because you have some experts internally that can help with this matching platform. The challenge is there are some people that have some really strong feelings about CCPS. And some people absolutely love it. And some people absolutely do not. And so we've done this work for about a year, and we have a couple of larger entities in the state that have said, we're moving away from CCPS. We don't want to put more disciplines on it. We would like you to think about going with a different platform, which was the alternative up front. But now we're at this point of nursing, I don't think, is ready to make that move. What do we do about the others? And so we continue down this pathway. So we're exploring this new platform, the financial viability of that, and whether we can launch that. So this isn't a no-go. This is it's really difficult to put these things together, and we're continuing to pursue that. So I hope in 1 year from now, I will have that solution and where we ended up. It's an evolving strategy still to have this logical matching component, but we're assessing the other dominant platform in the state. Does anybody want to say anything about that? This can be the participatory component.
How is it that matching is taking place now? Because I'm on the back end of it. I receive the students. Mm-hmm. So I don't know how they get to Maine. But I've always wondered how that happens, because in the last 2.5 years that I've been a leader and have taken interns, I had 4 my first year and I've had none since.
So I think the question is, how do the students get to the placement now? And so I think that happens differently at every single institution. And so in some cases, it's literally the UPS driver's kid that needs a rotation that you meet at the end of your driveway. That's actually happened to me. Can you take my kid? Or it happens through structures that exist, formal or informal. And that's what we're talking about. How do they get to you? Wouldn't it be great if you said, I actually want 3 a year, and I only want them in the fall or the spring or the summer, whatever you want. I want them spaced together, or I want them at the same time. And then you put that into an infrastructure, and so the schools say, oh, your site wants 3 and they only want them in the fall. I have 50 to place. Let me contact you so that you get all 50. Does that make sense? That's what we're trying to do. So I didn't answer your question because I don't know where you work, so I don't know how that actually happens. But that's how it generally happens across the state. Everybody's a little bit different. Okay, let me move on. So the 2 other strategies are to address health disparities in the state. 4 different groups identify Native American communities working. So I mentioned that the learning platform has curated materials, with this exception. We're working with Wabanaki Public Health and Wellness to develop some materials. So we believe most things are already developed in the world. And there appears to be a specific area that we could do better in this space. So they were identified as a subrecipient. Justice-involved individuals, specifically working with the Maine Department of Corrections and WellPath to increase the number of clinical rotations. Veterans, and most of our work is underserved communities, so that's pervasive. The 5th area is local supports for rural healthcare workforce training. And so we wrote this grant, and I was so pleasantly surprised that it was funded this way. we really believe that the support should be locally determined. And so the bullet point lists are the types of things that can be covered in a particular community, but not every community has the same need. And so one community needed a monitor to project to do distance learning. They needed a piece of equipment, and so that was purchased. Another community had a building for overnight housing of people coming to train, and they thought they could expand that. So we bought beds and a couch to expand space with these resources. So again, locally determined. Money is primarily going to mileage and to housing, a lot around housing in Maine, which I don't think would be a surprise to everyone here. So what has happened so far? So these are the top 15 disciplines of trainees. We've helped to support over 500 trainees, 524 trainees in the approximately first year of the grant in a variety of different disciplines. It's not just about training them. We want to see them get hired as well. And so of those that were trained during this period, about 140 for which we have data on, because they might train in one location and go to another location, so there's a reporting challenge here. About 140 have been hired in the training period. Also of note, not all of them are done with their training, so they're not even all eligible to be hired yet. When we look at supports, we've launched 27 supportive programs in 15 different disciplines across 7 different clinical sites. When we look at preceptor recruitment and development, this is a major issue in certain disciplines. So we know I'll use nursing school, for example, the number of seats are expanding, but the programs are saying we need more qualified faculty or preceptors. And so preceptor development continues to be an issue and varies by discipline. There are 77 new first-time preceptors that have been recruited through this work, and 18 have participated in faculty development. And so there are some contexts. Our website is Clinical Rotations in Maine. We decided not to go with the title of the grant, but really what we were trying to look at, which were clinical rotations in this state. So I will pass the torch to you. Thank you.
Thank you. So I'm going to be talking about the Merge Collaborative Grant, and this is a gracious grant and funded by the Department of Health and Human Services, and I have no disclosures or relevant financial relationships with anybody who's ineligible or eligible. Just going to do a quick overview, really thinking about talking about what we've created and the early outcomes so far. This group is very aware that rural residents face chronic shortages of all healthcare professionals. The Merge Collaborative is really focusing on physicians, but works closely with the Building Maine, thinking about all healthcare physician placements. But really, addressing healthcare access is a huge issue in all of the counties in Maine, and certainly in any rural state. Maine is not only the second most rural state, but we're also the oldest state. And for physicians, we're the number one in the country for the oldest physicians who are still active. And so folks really practicing medicine into their 60s and 70s because there's no replacement coming behind. We know that there's good national data that the rural physician workforce is not only shrinking but also aging, and so thinking about how do we get a newer, younger group in there that can commit to a community. And so really the Merge Collaborative is thinking about how do we recruit physicians to rural practices. And we also looked at the data, and Maine is actually really good at retaining our graduates, right? So our residents and fellows, these are the groups of students that have finished medical school, so they're physicians, but they can't actually practice until they finish a 3 to 6 year residency program to sort of be trained and accredited for their specialty. But we rank 11th nationally for retention of our GME graduates, which is really encouraging. And so how do we leverage that to get these graduates into our rural practices? And the support, there are 4 sponsoring institutions in the state of Maine who are accredited to do this training, this residency training. Eastern Maine Med, Central Maine Med, Maine Dartmouth Family Medicine Residency, and Maine Medical Center. And if we look at our collective data, we're actually pretty good. We keep about 50% of the residents that we graduate, but we're mostly putting them in urban areas in the state of Maine, and only about 20%. Maine Dartmouth is a little bit higher, but how do we increase that right-hand column? And the 4 sponsoring institutions have done a variety of different efforts to try to get their learners to rural settings. Maine Dartmouth Family Medicine Residency Program is the only technically rural training program in Maine. Central Maine Medical Center established the first family medicine rural track in Rumford, which closed during COVID. Northern Light just as launching a psychiatry residency rural track. And Maine Medical Center launched the first internal medicine training track, the RIM program, about 8 years ago, and we have had great success with that RIM program. If we can get residents to that, every single graduate so far has actually stayed in rural practice. And so this is a model that is being shared nationally in terms of thinking about it. We also have a psychiatry rural residency track that we're rolling out, a general surgery rural concentration, but those are just being rolled out right now. But the 4 sponsoring institutions have been working in silos for sure. And when we looked again at the literature, other rural states are really combining to create consortia or collaboratives to really leverage all of our opportunities to work collaboratively. And so that's what we did. We created the Maine Rural GME Education Collaborative, the MERGE Collaborative, and you can see our mission right there is really thinking about a statewide infrastructure specifically for graduate medical education. How do we get these new physicians out into rural settings so that they can engage with the community, realize the benefits of practicing in rural medicine, but also assuage some of their concerns about practicing in a lower resource area. So we created the MERGE Collaborative. This is our website, and we have 5 deliverables for the state, and I'm just going to quickly go through them. So first was actually to create the collaborative. We promised the state 4 new rural GME elective rotations, a rural learning platform, which Nika introduced the iHelp Maine program, thinking really creatively about faculty development. How do we support faculty who are accepting these students who may sort of theoretically really like the idea of teaching, but they actually haven't done it and are nervous about bringing in young physicians that they have to teach, and then thinking about pipeline. So we created the collaborative. These slides are available afterwards, and so I just included the membership. We promised 4 new rural electives, and we've created 32 new rural rotations, really disseminated across the state. 13 different specialties, thinking not just about we need primary care doctors, but we also need OBGYNs, and we also need folks who are interested in carceral medicine and addiction medicine. And so really thinking about how to vary not only the location of these, but really the types of physicians and specialties. We have 30 residents who've already either signed up for a rotation or have done a rotation, and we're marketing not only to the about 450 medical residents who are training in the state, but really thinking about those who are from Maine, especially those who are rural Maine, who are doing their training out of the state, and thinking about how we can get them to come back in. Really, I think that residents love it, and I just highlighted one sentence there. This is really what we want to do. We want to get people from rural Maine or interested in rural Maine actually to in those settings so that they can see how great this is. And it's too soon for us to tell, so we really have just had a little over a year for this grant. Residency training is a long, like I said, it's 3 to 5 years for the specialties we offer. And our calendar starts July to July, so we've really only had 1 year. But really what we're hoping again is our early data is looking very very encouraging. We've had 13 residents who've done a MERGE rotation and actually are graduating this June the 30th, and 5 of them are actually practicing in rural areas. And I think 2 of them are going to other rural areas, which is where their families are from. And I think that's why we need to get Maine kids who are training out of the state and want to come back to be close to their families. Those are the ones we really need to get to. So we're very encouraged with these. They're small numbers, but they're really what we're looking for here. Our faculty also really getting great feedback. And again, we are sending physicians. So we're not sending physicians in their first year of training. We're sending them in their second, third, fourth, and fifth year. These are people who are helpful, right? They can see patients independently and then go supervise. They can write orders. They can do discharge summaries. They can first assist in the operating room. And so it's very fortunate because we're actually sending a workforce that does need to be educated, but are actually useful. And this is a great, again, the highlighted sentence of how that was useful. So we decided to co-create the Interprofessional Healthcare Education Learning Platform for Maine, or I Help Maine. We sort of thought and did this together with our executive committees. You can get to it from the Merge collaborative site, and when you get there, you hop onto the learning platform. I'm not going to go over the 7 domains of training resources, but it was very important that we included any sort of general topic that any of the 20 most common healthcare providers in the state of Maine could use. And this was specifically an interprofessional idea as opposed to creating something like that just for residents and fellows. And so you can go to one of these, say you're a preceptor and you want to have your learner think about quality, safety, and improvement. You can send them to this website. They can decide, you can decide that you want them to learn about a culture of safety, and this website really curates high quality education. So they can do that as perhaps as a homework or in response to a result. We also curated the material based on the China's, the top healthcare areas of need as defined by the people of the state of Maine, and so you can look at this resources this way. And also, we just published another lens with which to look at this platform through the DEI lens. The rural faculty, as I was saying, it's really important to be able to support people, and so we created this really unusual Rural Education Leaders Academy, or RELA. We recruited 10 interprofessional educators, and so we have 7 physicians, a podiatrist, and 2 interprofessional members, and it's a rural learning community for 18 months. And the idea is to create local medical education experts in the places where we're educating. So not at the sort of ivory towers, but really thinking about how do we support these folks to be leaders and educators in the rural communities. And again, I list that. We also have faculty development. You've accepted a resident. Let's do an hour, just a Precepting 101 for GME learners. We can do it virtually. We've traveled to do that as well. And then we were really thinking about, okay, great, we put together this platform, but really that's a passive resource. How do we become more of an active resource? And so we started grand rounds the second Friday of every month, where we're just virtually offering it to anybody in the state who wants to think more about how to teach and precept any interprofessional learner. And we offer CME credit for that as well. And the last thing that we were thinking, we promised the state with some pipeline development. And we did 4 summer internships last year and 4 this year. And really, this was collaborative with Annie Durthick, who is the Associate Program Director at Central Maine Medical Center. And we said, okay, great, we've got summer interns. What are we going to do with them? And what we did with them is we had them go to a rural community in Maine. 3 of them went home. One of them was not from rural Maine. And we had them read the China report and pick one of the top healthcare needs in that China report and really do a deep dive and create a policy brief. So we provided them with the outline of what a formal policy brief looks like, and then we sent them off to do this. And we have 4 more students who are going to be doing it this summer, and all 4 of them are from rural Maine. But If you're interested, they're in our publication and presentation part of our website, and you can look and see what the work that they did. I have to tell you, I am a medical educator since 1997, and I am I've had it with interns, right? I'm like done with interns. And I am so impressed with what these 4 students did. I really exceeded all of my jaded expectations at this point in my career. But they, Abby DeShiphart is one of them. I just chose her as an example, but she's from Washington County. And she had to travel hours and hours to get prenatal care. And she was thinking to herself, how do we even think about taking care of opioid addicted? She wasn't, but how do you do that? And that was really what she ended up focusing on. And so she went right back to her community, and the pharmacist who knew her from 3rd grade connected her to this person who connected her to that person. And all of a sudden, she infiltrated this issue and came up with really a stunning policy brief with recommendations. And we did send these to the local legislators. Really a great job. And we had 2 on mental health access, and the 4th student was really looking at, looked at the China report and said, I'm not interested in any of these, but did you know that skin cancer, Maine is the 5th highest skin cancer in the country? And he went back to Kennebec County and was really thinking about how do we help with that. So super, super good stuff. For us, the next steps is really to continue to develop rural rotations. We're not sure what the sweet spot is, and really focusing on northern and down east Maine, and think those partners. Continue to recruit learners. An article in Academic Medicine in 2018 is a rural upbringing is the most common predictor of entering rural practice. And so how do we tap those folks from the state of Maine or from other places as well? We're looking at feedback. How do we make this better? Continued learning platform development. I think our next lens is specific rural competencies. There were just some published last year about what are the unique competencies to practice rural medicine. And of course, geriatric medicine and aging competencies is going to be another one. We're hoping to hear positively about, we were included in a UNE grant application for geriatrics. And if they get that funding, then we really will be able to do some good stuff on this learning platform. Continue to align with education partners. Fascinating to sit here today, and I was like, Nika needs to speak to this person. I need to speak to this person. We all doing a lot of the same work. Aspirational steps. We know we're thinking about sustainability and how do we continue the work that we're doing. Is there a way for the 4 sponsoring institutions to co-create an opportunity to train family medicine practitioners who want to practice obstetrics, including C-sections? A huge issue in our state. No one sponsoring institution can do it in the state of Maine, so can we leverage the Maine Merge Collaborative to actually do something like this? And then a future role for the Merge Collaborative to help as an input site for foreign-trained medical graduates who are really thinking about how do you get them into the U.S. medical system and credentialed and accredited appropriately. Sustainability, we're thinking about it all day long, every day. This is an awful lot of work to do without sustainability. We requested and were granted a 1-year no-cost extension. We are hoping to get a grant from the Buck Foundation to help us pay for things like housing and more faculty development. We'll hear about that in a couple of weeks. And there is some state legislation pending. So, but we believe that this is a return on investment, right? If you are in a hospital system, you know how much recruiting dollars and how much locum tenens dollars are spent on physicians, and really feel that this, if we can get people in from the ground up, that there's a lot of opportunity for return on investment. These are the 4 main GME directors from each of the 4 sponsoring institutions. And it's amazing that this is the first time that the 4 of us have actually worked together formally. And so it has been a great opportunity, not only for the merge, but somebody saying, there's only 4 people in the state of Maine who have my job. And so it's nice to be able to say, have you had this problem before? And creating a small learning community. And thank you to Joy Gould and Lisa Letourneau, our contacts at the Maine Department of Health and Human Services, has been super helpful. It's been a privilege to work with you. And Dave McClellan, who's the program project manager. But so much more. Dave comes from a long history of not-for-profit work, and so is really helping co-create this in ways that I certainly wouldn't have been able to do that. Oh, and there's your picture. So either one of us will take questions.
Questions, ideas, suggestions?
I just have a comment. I was glad to hear that geriatrics is included. I work in long-term care, and it really started with COVID, but we do a lot of telehealth now, and medical directorship, which is required in our buildings, so we now have telehealth, and it's very confusing for our elder population to be provided these types of services over a video screen. So I'm just glad that you took the time.
We both agree that we need to get learners into long-term care facilities, but also home health, as we're thinking about how do we provide care in somebody's home. So those are sort of the next things that we're both thinking about.
Can you tell me some more about the family medicine OB fellowship idea with the distributed training model? What are you thinking about?
Do you want to repeat that now?
Oh, sure. Could you tell me more about the family medicine OB fellowship, which certifies family med physicians to do obstetrics and C-sections, and how it would work with the distributed training model?
Yeah, it's such a missed opportunity. The 4 sponsoring institutions, we actually sat down to write the HRSA grant. And the way the HRSA grant was written, it said it had to be an ACGME accredited OB fellowship for family medicine. There's no such thing. That doesn't exist. It's the ACGME doesn't accredit it. It's the BOMS that accredits. And that one tiny mistake on HRSA's perspective prevented us from applying for it. So we'll look again next year. But essentially, one of the 4 institutions would own the program, so you have to have an accredited program sort of owned by somebody, but they might do 3 months at Maine Medical Center doing 4 C-sections a day, but then may also go to Eastern Maine, and really the clinical experience would be disseminated. It doesn't make sense to any of us to do a family medicine OB fellowship in a rural setting in Portland, but it does make sense to spend time in Portland and do 20 C-sections a week, if not more. So I think that's what we're hoping. That hasn't been done yet, and we need funding for it.
When you guys went over the allied health stats earlier, the lab profession was not on it, which surprised me. And I was wondering if there's room for us, or if there was a reason for not including that.
Yeah, so we wrote the grant, and anything can be added. It's written in, so that was the list that was sent in, and all others that we have forgotten on this list, because we were writing a grant application really quickly, so we wrote it that way. You are absolutely welcome. You want to talk? Okay, let's do that. There were others that were left off too that always feel bad in these moments. Audiology is welcome. They're not on the list. I mean, there were others on the list. So I'm going to ask you a question. Are you sitting there thinking, one or the other of those programs, I have a place that I could connect, I should connect, or I would like to connect? Is anybody thinking that? Can you raise your hand? 1, 2, a nod and a hand down here. Okay, maybe 5. You spoke up 6, 7. Okay, so those are the connections that we're both looking for. This is complex work. Both of our grants are statewide. I think I forgot to say that. I started to say, are we doing this alone or are we doing this with a group? It's the whole state for both grants. And so we want to talk to you or with your peer. Sally.
I'm just thinking about so much. I'm just sitting here thinking about, I'm from the Maine Hospital Association, from the subrecipient of the Build to Need grant. But I'm just thinking about this past legislative session and the tremendous focus on behavioral mental health and access, and just trying to think a little bit more broadly about how both of these programs could support building greater access to those services in the community. I think with the Building Maine collaborative, which has been fantastic, a lot of those clinical sites that have been identified so far have been hospital-based or FQHC-based. And I think there may be a real opportunity for connecting with the smaller provider organizations that do that integrated community behavioral health, and try and figure out how do we connect them to this work. It's more what I'm thinking about and kind of putting it up there.
I appreciate that share, and I know we have some others in this space that may be working on that group. Would love to talk about that. Behavioral health, and in the previous session talking about oral health, both of those two areas of healthcare are often marginalized, distanced, unavailable, underfunded, whatever the topic of the day is. They're challenging for people to access, and so I think there's a lot that can be done in behavioral health.
Yeah, and I think it's tricky because we're talking about training, right? So I think it's how do we get people into these areas? Eastern Maine Medical Center has a rural psychiatry track, and I think with that there is access, different than the electives, and Maine Medical Center has a track. And so when we can put 6 psychiatry residents someplace, then all of a sudden you are opening up access. So I do think that there's more opportunities for a longitudinal education as opposed to what we're currently focusing on, which is just these 4-week electives, which is really to encourage people to go. But I think if we train them there for the majority of their residency, I think we're going to see some improvement in retention, but also we're providing a service to the patients in that area during that time.
I think we're starting to see through this work opportunities as well of building a culture in a particular organization. So you take one type of learner, and then we do a little bit on faculty or preceptor development, and then who else within your organization would be interested in taking a learner. Completely different discipline. And then you're building a kind of what Callie talked about on building this rural expertise in graduate medical or in medical education and health professions education. We're seeing it on an organization by organization level as well. You're not so isolated, you're not doing it alone, and it's actually okay that you're doing this, which is not always normalized in every organization. So I think about what was just shared about putting psychiatry residents in a community. Well, what about social work? Could we actually have them there at the same time? What about others that are in the same organization, either formally together or informally there? We build some capacity, and there's that opportunity. And I'm looking at some faces in this space that might be a good fit. And it's 11:44. Any last comment? Yes.
So I saw that you was Readington Fairview, which is an independent access hospital, but has there been any other reach to some of the other independent hospitals?
Yeah, Sally, do you want to take that one?
For Merge or Building Maine? Both. Yes. So I can say for Merge, yes, we have reached out to just about every hospital system and in the state, to every hospital system in the state. Not everybody is ready to take learners at the graduate level. So Reddington Fairview is a great example. So we met with them. They're not quite ready, but we just put a resident there who did a Merge rotation, and we'll go back next year and say, hey, will you take a resident? And so we're talking to a lot of different partners. I will say for the Merge Collaborative, we actually help them set up the actual rotation. And so we're helping them with educational objectives and accreditation language. We provide evaluations. So we're very, very deep in the weeds in trying to make it as easy as possible to take somebody.
Yeah, and I think for independence, so Mount Desert Island Hospital, MDI, in Bar Harbor, we have Cary Medical Center in Caribou, and we have Millinocket Regional Hospital. So we do have some other independent critical access hospitals that are involved in the Building Me collaborative. I think though, I'm a little bit unlike the Merge collaborative. This is really, because this is a new grant, it's really putting it on the hospitals to identify what they need as Nika identified. So trying to work with them and think a little bit outside the box. And I think also, some of them are so short-staffed, it's really challenging to think about, how do I take more learners, even though I desperately need workforce? And I think that's still an area that is a challenge, it's a barrier to expanding this work. And I think that's where, policy, funding, other things that potentially influence someone's ability to expand clinical training is really what we have to push next.
And I would completely agree that capacity within the healthcare system to take on learners, like really basic thing. I talked about badges and parking and some of the where they're going to live and supporting people for that transition. That is a very real issue. And so when you loop multiple disciplines together, you don't need to build that for social work and nursing and medicine and PT and OT. In a smaller hospital, a single office or a single person can take care of that. And one of the hospitals that you mentioned, they were struggling a little. They were written into the grant, and then when it came time to be funded, they're like, we're not sure we want to actually we don't want to deal with those disciplines. I'm like, what do you want to deal with? And they really struggled with that, and I said, who in your organization is retiring for whom you don't have a replacement? And they were very clear on what they needed, and they said, oh, she actually wants to take learners. She's been saying that for years. And so it's about relationships. What do you need? And can we hook you up with an academic institution in the state to get you one or more trainees to come so you could actually retire and health services could still be delivered? So if you walk away from here going, what could we actually do? That's the kind of question that seems to resonate. Thank you for coming.
Thank you very much for coming.
And lunch is back in the same room.
Good afternoon, everyone. How are you all? So I'm a little bit different when it comes to presenting. I'm not going to stand behind the podium. I'm not going to sit. I'm going to walk around the room because that's what I do. So all of you do me a favor. Stand up. Put your arms over your head. And stretch. Doesn't that feel good after lunch? We've all been sitting all day, having people lecture at us, so we're going to stretch. The last woman was great talking about how we need to take time for mindfulness, right? So I wanted to give you all an opportunity to stretch. Your bellies are full. You're probably ready for your afternoon nap, but all right. So we don't have very much time, which also I'm a talker, so probably not the best to put on a time restraint, but hopefully you're all here for the leveraging training collaborations of workforce growth. Yeah? Good. So first, I'm going to take a moment to introduce myself, and then my co-presenters are going to introduce themselves. So I'm Dr. Kayla Sikora. I am the Director of Augusta Adult and Community Education. I entered adult ed through the side door. I used to be a certified dental assistant, and that's what led me to being an adult ed director, believe it or not, because I started teaching a basic dental assistant class. And I fell in love with the demographic of students. So I went back to school for my master's in adult and higher ed. And my advisor, Mike Brady, I'm not sure if any of you know Mike Brady, he was the chair at USM in the adult and higher ed program for a long time. He said, have you ever thought of the public sector? And I said, no. And he said, well, like helping people obtain their high school equivalency, you'd be great at that. And I said, oh, I never thought of that. So I went and I started working at Oak Hill Adult Ed, and I was teaching high-step prep courses and credit recovery. And then I said, okay, I'm never leaving this field. So eventually I became an adult ed director. I got my CAS in adult learning, and then I got my doctorate in education. So that's what brought me to all of you. I've worked in Augusta for 2 years now. I absolutely love working in the capital of Maine. We have a very diverse population, and I get to connect with healthcare organizations like Maine Veterans Home. So that brings me to Desiree, our partner.
Good afternoon. My name is Desiree Knowles. I'm the Staff Development Coordinator at Maine Veterans Homes in Augusta. I've been with Maine Veterans Homes for about 3 years now. I did something very different in nursing before this, but there was an opportunity to be part of Maine Veterans Homes and their new campus in Augusta, and I can say it is one of the most exciting projects I've ever had in my career. So.
Hi there, I'm Karen Morin. I am, many call it the Career Advancement Specialist, the Career Navigator. I'm attached to the Department of Education. I cover Kennebec County and the Hub 5, which are the 5 adult eds in Augusta. My background is incredibly diverse. I cut my teeth working in the psychiatric field. Some of you might have gone to the Riverview apprenticeship. I worked for 10 years at Riverview. It used to be AmHigh back then. And then I morphed into crisis work, and then I managed medical and mental health facilities inside correctional facilities. Then I decided to try my hand at the military, and I worked as their risk management person there for 8 years. And then over the last year, I said, wow, why not change again? So this is my 4th job in my life, but I absolutely love working with this population. And I think my background in mental health and law enforcement, and it kind of, now I'm working with new Mainers, and hopefully we can bring it all together for you today and kind of see where it goes.
Thank you. And Karen works very closely with the adult ed program, so we rely heavily on her to go out and find us employers to partner with. So Karen plays a huge role in what we do. So our presentation objectives. When I go to a presentation, my biggest pet peeve is you go and you think you're going to get something out of it, and you walk away and you say, that is not what I thought I was going to get out of that presentation. So I want to make sure everybody's here for the same reason. So we're going to talk about successful training collaborations firsthand, specifically the collaboration between Augusta Adult Education and Maine Veterans Home, because we're super proud of what we do, and we want to teach all of you how to do this. Okay? And then we want to discover strategies for effective partnerships and establishments. And then learn methods and skills to enhance workforce training and growth. And then we are also going to highlight student stories throughout our presentation. Does that sound good? Is that what you're all looking for? Thumbs up if that's what you're looking for. All right, I would also like to know who we have in the room. How many of you are healthcare training providers? Raise your hand. Do any of you partner with local adult ed programs? Good. How many of you are educational institutes or work with educational training programs? Or 4? Erin, what do you do?
The only I'm the executive director for the Central Western Maine Workforce Development Board. That can be a partner in all of this.
Perfect. Thank you. Okay, so first we're going to talk about the background of Augusta Adult and Community Education and the background of Maine Veterans Home and how our collaboration began. So for those of you who are not familiar with adult education programs, we offer a wide variety of training opportunities for community members. Most people, when they hear adult ed, they think GED and basket weaving. No. Basket weaving is beautiful, but I refuse to ever offer it in my program because that's what people always say. Oh yeah, I love the basket weaving and the GED. We don't do GED anymore, so please eliminate that from your vocabulary. We do the high set. So if you hear anyone say, oh, I just got my GED, they got their high set. Maine has not administered the GED since 2013. We do the high set, the high school equivalency diploma. So besides that, we offer some classes for multilingual learners, so English as a second language classes. We offer enrichment classes. We also offer training programs. We offer college readiness programs. What else do we offer? High school diploma and community enrichment classes. So part of our efforts to grow our training programs in the community, we're partnering with Maine Veterans Home to offer an Earn While You Learn CNA course. And that's where Desiree comes in. So I'll pass the mic off to her again.
Yes, so our partnership, enhanced back when we needed to increase our workforce through our new building. So we are the first small house model of care in the state of Maine. And with that, we needed to increase the amount of employees by about 30%. That started back in 2019. We've heard a lot about it today. We all know what happened in 2019. We all know what that was like. And increasing your workforce wasn't something that happened then. We moved to our new building in March of 2022. About, I would say, 3 months later. That's when Kayla and I sat down. We had lunch together. She came over to our new building, and we really talked about how we could enhance our programming and really reach out to the people that needed it. And she has been a huge partner with that, with us. And about, I would say, the program we're in right now, half of those people in that program came from the partnership through her that she referred to us, that we probably would not have gotten without that partnership.
So this is the day that we signed our MOU. So you can see both myself and Desiree there, and then I have my program coordinator. We have the CNA instructor, and then Amy's title, Senior Recruiter. So we all work together regularly. We are talking to each other, emailing each other on a regular basis. And I think that's why our partnership is so successful, just because we're willing to reach out no matter what. So benefits and impacts. So part of my mission as the adult ed director in Augusta is to help provide training and employment opportunities for our learners. And Desiree has just been a huge champion in that because they are also located in Augusta and they have a healthcare shortage, as we all know. But also just promoting people within our community, promoting that local economic growth. Do you want to speak to some of the benefits?
Yeah, sure. Absolutely. So part of why I think our partnership is so strong is being on the same page about what we're trying to achieve. So there's going to be slides to come that will talk about some of the programs that we do together. But I'm gonna jump ahead and say one of them is a CNA program, right? So with that, the difference that we get to do that's something a little bit different. People have been having their own CNA programs. Healthcare entities have had their own CNA programs forever now. They've grown their own. That isn't necessarily, I think, a new idea, though during the pandemic, that did stop, right? We needed everyone on the floor to be doing direct care. So you kind of saw that plummet. And then, come back to fruition post-pandemic days. We get to also, for the company that I work with, work for, that they're great about believing in being part of the solution in the community. We take in people through our CNA program that are not our employees, that may not want to be our employees. We may not even have a position that they're looking for. If they're looking for a full daytime position, day shift position as a CNA when they graduate their program, currently we do not have one of those for them. But if they really want to be a CNA and they interview and they're the right fit to be in healthcare, we believe that we don't want to lose even one person that wants to be a CNA. They're able to come for a free program. We, support them through the process. Their books are paid for. Everything's paid through the grant funds that we've kind of all heard about today. We have graduation with them, and they can work anywhere they would like. We believe, again, it's being part of that solution. Everybody needs CNAs. And what that does for us as well is, they have a great experience with us. They remember the people that they were in class with. They remember the people, the leadership in the building. And, 5 years down the road, they may come back to us. They may also refer someone and say, this is a great program, you should go through their program. We also support other healthcare entities, so other organizations. If they're not running a program right now, or they can't run a program for whatever reason, they don't have an instructor, they can send people to us for free, and they will go back to their organization and work as a CNA for them.
She's amazing, isn't she? I mean, for real. One of our partners who isn't here with us today, Elizabeth Fortin from Kennebec Valley Community College, she has been such a champion and helps support what we're doing, buying seats for students who maybe they aren't going to work for Maine Veterans Home when they complete, but that funding's available for them because, like Desiree said, we don't want to turn anyone away from healthcare opportunities. Oh, I skipped one. So how do we identify students for our program? Augusta Adult and Community Education advertises the program, and we the registration process goes completely through us. So if a student is interested in becoming a CNA, they will fill out an application on the Augusta Adult Ed website saying, hey, I'm interested in your Earn While You Learn CNA program. Then we have the student come in for an intake process where we will provide intake paperwork, we'll talk with the student about their future goals, and then we administer the CASAS assessment. How many of you are familiar with the CASAS? Perfect. So the student will sit for the reading test, and if they reach that score of 240, they're eligible to enter the CNA program. However, if they don't reach that score, we will provide tutoring and support for that student right at the adult ed program to get them up to that reading CASAS score so that they can move on to the next step of becoming a CNA. So just because somebody comes in and takes the CASAS and doesn't meet that minimum score does not mean we turn them away. We provide educational supports to help them reach their goals. If they come in and they test at that 240, we pass them over to Desiree and Amy, where they actually go through an interview with Maine Veterans Home, because one of the great things about their program is they hire the student on as an employee. That's where the Earn While You Learn comes into play. And the student works as a health aide while they're going through the CNA course. And I will let Desiree speak more to that.
She caught me off guard a little bit with that one. Yes, so there are, again, multiple opportunities. So some students that we bring on ahead of time are interviewing with us to be our employees. We hire them in a unit helper capacity first. They go through our general orientation like anyone would that's coming on board with us. And then they go through the program. Every program, I feel like we change it each time and we do something a little bit different. Our most current program that we're in, they have classes on Monday, Wednesday, and Friday. If they come on as a full-time person, they're gonna supplement those hours and work for us in a unit helper capacity the days that they're not in class. Now, we also realize that they may not want to be a 40-hour employee. So if you want to be a part-time employee and you want to work 24 hours, we're still going to hire you on if you're the right fit for us because we can have you be a 24-hour employee. Maybe you want to be a per diem employee because actually you're coming to this CNA course because then you're going to nursing school, and you know while you're going to nursing school that you're not going to be able to be a full-time and maybe not even a part-time employee. So we have lots of different opportunities for them to come on board and be our employee and not just be that you must have those 40 hours. I think we've heard a lot about this today, but if you really only are able to be a 24-hour employee because you have a lot of other stuff going outside of your work life, you could be a fabulous 24-hour employee, and we're going to support you in that. It doesn't have to be 40 hours.
Oh, it's back to you, Desiree.
So I jumped ahead a little bit and I talked about this already, but I wanted to mention, Maine Veterans Homes in Augusta, we are the first small house model of care in the state of Maine. So our campus we just moved in 2022. I had mentioned that. It consists, and it sounds very different, it has very different language with it. It consists of a community center, which is really in the heart of the facility. It's right in the middle. What surrounds it is our 4 villages. They are all of a Maine theme, and we have 12 houses. Each village has 2 to 4 houses on it where 10 to 12 residents live. So it's a very holistic style of care. We're very excited to be doing it. So it is not only that the building is set up to provide that model of care, but all of our staff are trained to also provide that model of care, very different than what you might see in the industry. And I did put in there that we have a wonderful classroom space because that was really important and exciting for me that, that's another piece. You can have the staff on board to be able to train, but you got to have the space to do it. I think we've all seen it if we've been in healthcare. You kind of like makeshift your rooms of we can do a training in this room, we'll fit. So we have, a very nice space for us to be able to do those different classes that we offer.
Show of hands, how many of you have seen the new Maine Veterans Home here in Augusta? It is gorgeous, and if you have not been over there for a tour, sign up, go over there for a tour. It is all long-term care facilities should model what Maine Veterans Home has done. You walk in, it doesn't smell like a nursing home. It's beautiful. They have a Starbucks, and if you visit Desiree, she'll get you a Starbucks coffee. But no, honestly, it is such a beautiful facility. They have great classroom space, and we're so proud to partner with them. And this is where we talk about the types of training opportunities that are available.
So I had mentioned this, so our CNA program, again, I put on there that who we collaborate with and the different pieces that, there are free opportunities to the public. It's not just all our own employees, and as well with other healthcare organizations. It was mentioned in an earlier presentation that I was at today, and I was really glad to hear it. When we think of healthcare organizations, we think of saying the word healthcare and then competition. And really, I don't feel like it's a competition. We're all in it for the same reason. We want to care for other people. And so, again, I'm happy to have people in our class that are going to be needing to work somewhere else as well. We all need CNAs. We can have up to 10, students with one clinical instructor. If that's what we're choosing to do is run one clinical instructor, then we want 10 people in that class, whether they're ours or whether they're someone else's. There's no reason for us to have a nurse that is also, in very high demand, doing that work and being with them and not have the maximum outcome that we could have.
Back to you. I'm sorry, we piled all your slides up right in the middle.
So again, we do a certified nursing assistant medication course or a med tech course that you're probably more used to hearing in the industry. We do that for our employees. Of course, if you are already a CNA at Maine Veterans Homes, you want to be a med tech. We do that as part of retention and growth within. Right now, we have one coming up later this year. And again, it is for the retention of our staff. We don't currently have any med tech positions open in our building, but people want to be med techs. So we will put them through the med tech course. We also, our last med tech course we did, we collaborated with another healthcare organization that wanted to put someone through a med tech course. They didn't have the means to do it in their building, so they came over to us. We trained them as a med tech, and they went back to their building.
So another piece that I haven't spoken about is Augusta Adult and Community Education does provide the state exams for Maine Veterans Home. So in addition to the students coming in and doing the intake paperwork with us and doing that initial CAS exam, they come back to us at the completion of their course for their state CNA exam. And we're also doing the med tech exams now too.
So I just wanted to mention some of our other, community partnerships, because we all know that it's not all one answer, right? Like, you have to have multiple people that you partner with. So being a resource for, we have Kennebec Valley Community College, KVCC, that comes to us. This year we'll have 4 clinical groups from them coming to us. UMA also sends us 1 to 2 clinical groups. Beale University, we have people from both their Wilton and their Bangor location. And then Central Maine Community College will be coming to us this year as well. So, also making sure that we are a resource for the community. We can't have more nurses if they don't have sites to go to. And trying to make it as easy for them as possible. Getting them onto their computer system, showing them the building. We feed them lunch, making sure that they feel comfortable in their surrounding and their instructors feel supported as well.
So now we're going to talk about some success stories. So first, I would love to talk with all of you about a student named Sadie. Sadie came to Augusta Adult and Community Education without her high school equivalency diploma, without a high school diploma at all, and she never thought she could become a CNA because she didn't have that credential. And Desiree and our program coordinator said, you can become a CNA and you can finish and get your high school credential with Augusta Adult and Community Education, and then if you want to, later on you could go on to nursing school. So Sadie completed the CNA course, and she is working with Augusta Adult and Community Education on her high set right now. And we just love Sadie. She's one of our success stories. And I'm sure if she were here, she would tell you all that she just needed that one champion, that one cheerleader. And I know that her and Desiree really connected. And if you want to speak to her, maybe share another story.
An additional story would be, we have a student that was, when we moved to our new building, was one of our first students in those classes that we had there. I got to work with her on an overnight shift not too long ago, and it was really, you have that proud and humbling moment that she is an amazing caregiver. She now had called me the other day to do her preceptorship through her nursing program, would like to know if she can do it at the facility where she currently works. So she just really needed someone, like you were saying, to be her cheerleader, to say, you can be a CNA. And now she's in a nursing program. And those are really, kind of why you do what you do every day, is for those moments, those success stories, and for those students.
And pictured here is our first class where we collaborated as Augusta Adult and Community Education in Maine Vets Home. And the graduations are always super special. I honestly feel like I cry every time I attend one. Just the students are amazing, and the opportunities that they get working for Maine Veterans Home is amazing. Even the partners that send their CNA or their employees there to receive their CNA training, they get so much out of the program and the opportunity. We really are a community that is lifting each other up. And like Desiree said, there's no competition. We want everyone to win. So any way that we can help anyone in the community, that's what we're going to do. So next, I would love for our career navigator to speak a little bit. She works primarily with our new Mainer population, and Desiree and I are hoping to start another program where we're going to bring on some new Mainers and hopefully offer some multilingual learning classes on campus, providing these new Mainers with entry-level positions. This is not something we're currently doing. Augusta Del Ed is doing this in partnership with Maine General right now, and I told Desiree about it, and she said, we could do that too. So something in the works, but Karen can speak to this.
Hi there. So as you can see in this picture, I have to throw somebody under the bus as well. She spoke of our interpreter, Mahmood. He's in the, and I have to have him stand up and kind of, thank God for him. I feel like he's my right hand. So if you want to hear a great story, take some time and get to know him. Working with new Mainers has been, I was so excited. I was like, oh, something I've never done. Well, that comes with a lot of challenges. Number one, most of them don't come here speaking English. So if you can imagine, part of my role is to assist businesses with coming up with a plan or assist them with finding employees. And we all know that there's no shortage of jobs out there. I think the last was there's 2 jobs for every 1 person out there. And so we have new Mainers coming in. I have people from Syria, Afghanistan, Iraq, Angola, DRC. So we're not talking just Arabic, we're talking French, Portuguese, Arabic. Thank goodness Mahmood can speak quite a few languages. But if I were to say to any of you, if you're looking for employees, consider the new Mainer population. They do want to go to work, but we need a pathway on for them in the way to get there. And the challenge is English a lot of times, because a lot of these healthcare jobs, we need to have safety, we need to have security, you need to be able to communicate. So that's where we've all come in. And Mahmood and I teach American culture to them while they're teaching us about their culture. And what that means to us is Americans, as you heard in the speaker talking right after lunch, we kill ourselves in our jobs, basically. Nope, we're only gonna get ahead if we skip lunch, if we do this. In a lot of these other cultures, when I work with these new Mainers, they're like, what do you mean you start at 7 o'clock in the morning, 8 o'clock? Oh, the day doesn't even begin till 10. And I'm like, we could learn something from them, seriously, because, they're further in the day, they take time for their families, they're very community oriented, and they prove to be really hard workers. We've had a lot of them, we have currently 3 of them working in our Maine General program, which I'll briefly, I know Maine Vets Home, and I'm like, yes, but right now I'm working with the Maine General program. So from start to finish, we work with the new Mainers, we get them up to speed. Mahmood and I go with them, actually, to their interviews, and you'd be surprised, even with the people that I'm working with out in the community in Kennebec County, it's amazing the difference the pandemic has had. And I know I don't want to kill that, but people are stuck. People are like, oh, to get a job right now, I have to apply, I have to send a resume, now I have to wait. Then when I get a call, it's probably 2 or 3 weeks before I get an interview. And then after I go through all the backgrounds, all the process, it might be 2 months before somebody's getting a job. And I bet a lot of you are feeling it out there. Sometimes we lose people in that amount of time. So sometimes we need to start thinking outside the box. Not that we don't have to do processes. Processes are important. But sometimes if we can find something that might work a little bit differently, and this is what we've done with our new Mainers, and that we've helped them with their resume, got them going. I've gone to so many interviews with people and helped them, and sometimes when somebody, especially a new Mainer, is doing an interview, sometimes they walk away and they're like, I don't know what happened. What did we talk about? What does this mean? And it's kind of like just having a mentor with you to assist you along the way. And I really wasn't sure if I wanted to say that, because I know in working in healthcare and any other field, you're like, if they need that much help, are they going to be good employees? The answer is yes. Sometimes it's that process, it's that fear of the unknown and how we're going to get from point A to point B. Because when somebody decides that they want a job, I mean, let's be real, when do they want the job? Now. They want the job now. So if we're taking too much time to think about it and process and do, sometimes that doesn't help in our favor. So some of the things that we're doing now, you can see Mahmoud and I loaded up 7 people and took them to a job fair where they got to be interviewed on the spot. Consider doing cohort hiring, taking a bunch of people all at once. Let's get the process going, have a team of people. That's what we do with Maine General. We have a team. They explain everything. We go through the process. We take the time. We have an interpreter there. Now, a lot of our people are going into entry-level jobs because their English isn't to where it's supposed to be. But the goal with all of these people is to get them their English up, because how's your English going to get better? By being around other English-speaking people and being able to be part of our culture. Sitting at home and praying that your English is going to get better doesn't work. So we get them in entry-level jobs, and with the goal, if they want to go into healthcare, once we have the class at Maine General, we have an English teacher who goes there and works with them during the week. And once they are up to snuff with their English, then we consider them for a healthcare and maybe going into a CNA program, maybe at Maine Vets, maybe through Maine General or what have you, and we work with them and we stay in touch with them. And I think that's also an important thing. Once somebody gets the job, that doesn't mean that they're okay and ready to go. Sometimes they just need somebody to bounce things off or talk to or just kind of say, this is okay. And I know it sounds, I mean, every fiber in me, being in my late 50s, is saying, but you go to work, you do your thing, you don't complain, you just do it, you do it. But we need to think differently now. The world has changed and the way that people are thinking is different. So my job has become, I would say I'm a holistic navigator. I know that sounds weird too, but I think that hand-holding is okay until somebody's ready to go on their own. I think that getting them to where they need to be, sometimes it takes 30 days, sometimes it takes 6 months, but if the outcome is that you have an employee who's engaged in the community and wants to stay, is it a win? Probably. And we're seeing that people want to stay employed, and we've done a lot of hand-holding, but we've had a lot of success stories so far.
Thank you, Karen. And that just brings me back to the connection piece, right? We all work so well together. We all communicate, and we're all always looking for how are we going to help these Kennebec County community members find employment and maintain employment. Oh, this button is tricky, guys. So one other thing we wanted to touch on is overcoming challenges. And the 3 of us met on Friday, right? And we were like, there are not a lot of challenges. But there are. So, of course, there are challenges. But I think because we're all such a connected team that we are always troubleshooting and problem solving. So finding the right partner is key, and just maintaining that relationship. And any healthcare organizations in this room that would like to partner with somebody, I would say partner with Adult Eds. We're willing to work with you. We're willing to help find employees for you. We're willing to help provide services to support training opportunities. We advertise, and we are really flexible and willing to do whatever you need as an employer to help with your training programs and to help recruit new employees. Do you want to speak to some of that, or have you spoken enough?
I've spoken enough. Keep going. I don't have like she said, the challenges are, team-wise, there's not a challenge between, the partnership at all. We put a few things on this slide. We utilize funding right now. That funding's supposed to end. I'm not sure where that will go. We'll still be having courses, and knowing the team that I work with, they'll say, oh, well, they want to be in the course, just put them in the course then. All right, just put them in the course, it's fine. You know, and we put a healthcare shortage on there. You know, again, that's a challenge for everyone. There's a healthcare shortage, and we just need to find a way to keep training people to be in the healthcare field and keeping them there.
So the funding that most of us are accessing right now is through the Strengthening Maine Workforce Grant. And that funding is supposed to run out. But I feel like the three of us are pretty resourceful and we'll find other funding to help put people through courses. So future directions, we really want to grow our collaboration and programming. Desiree really wants to be a recertification site for CNAs. And we're talking with Robert Carr about how we go about doing that. And then again, we're exploring the MLL collaboration, so multilingual learner collaboration. Do you want to speak to the recertification site, or is that self-explanatory?
It is pretty self-explanatory. I mean, if you have CNAs that have not got their required hours in healthcare and they let their certification lapse, they have to go through a recert program. We don't currently have one in the Augusta area that's very close. So it's, I feel like it's just sad that we, you know, aren't serving them in that way. We need CNAs. Well, if they just need to be recertified, let's get them recertified. So we have nurses on staff with us, you know, myself included, that would be happy, you know, to recertify CNAs. And it's, you know, just setting it up through the state, partnering. You do have to partner with, you know, in a educational entity, because it is a two-part piece. They would need to do the testing for it, and we would need to do the hands-on skills.
So we are at the end of our presentation, but we wanted to open it up for questions from all of you. Does anyone have questions about what we're doing? Yes.
So my questions, my agency is in the greater Portland area, and a little over 80% of our workforce is new Mainer population. I am brand new to the agency and to the field, and I have noticed, you know, today's the first day of my third week. So I've noticed some differences in culture between our staff that are, you know, born and raised in America versus the new Mainers. Aside from partnering with the local adult ed offices in the greater Portland area, what are some suggestions that you would have for me to help kind of bridge that gap?
Karen, I'll let you answer this one.
It's a really great question. I think that, again, thinking outside the box, I mean, I was like, how can I integrate these people? Some people aren't going to want to go to adult ed, right? How am I going to get them connected? And I said, wow, where can I get them around people? I went into a local Sam's Club, and I'm like, hey, I know you're looking for people. What do you think of this? And they're already on the bandwagon to jump in and collaborate with us. I think getting them connected, local libraries, we have a couple of groups at the libraries who we just started up conversation groups. I think anything that you can get them involved in the culture, because what happens with a lot of new Mainers, they stay in their own groups. You know, understandably, they stay in their own communities. They don't bridge out. So the more that you can, volunteers, get people to come in, see if somebody will give them a ride, see if somebody wants to do something socially with them. The more that you can integrate them into our community, I'm telling you, you know, it's a great thing. And they seem to be all the best cooks in the world. I have had so much great food in the last year, and I'm saying, you know, that's a definite benefit, you know. So Mahmoud's smiling at me because he knows what I'm talking about. But integrating the best you can into the community, get people involved.
Find out what their interests are, and then try to connect them to the appropriate people. Definitely goal setting, goal planning is so important. Does anyone else have any questions? Except for Aaron.
I'm loud enough. Right? So I'm very interested in the approach of, not just people who are going to be employed through but anybody. So if somebody came in and that was not going to be employed for you, with you, would you still do that earn and learn? Would you still hire them as like that health aide or?
So that's where it is different. The people that are so it's an earn to learn opportunity because they are going to be our employee. That's why we try to do classes a little bit differently each time. Our class, like I said, we're currently in is Monday, Wednesday, and Friday because you still have to work your job most likely, right? You have to make that, and we understand that. We have someone right now that is working a full-time job and doing her class because she is committed to that process. We try to do it, advertise way in advance so I can talk with people about this is what the schedule would look like for you. Is this something that would work, through what you're doing for your work currently? And by doing it, I think a little bit differently like that, it takes a little bit longer. We also only are doing 6 hours of class time and 6 hours of lab time in a day or clinical. And that's really, because we're used to in a traditional, you do those full 8 hours because it's going to take less time. They're going to get through it. But that's a lot of classroom time. So we've shortened it also so that people are having a better experience and being able to still work a job if they need to. Our summer course is Monday through Friday. This is the first time we're gonna try this, but we got last year a lot of people asking about, specifically, I didn't know about this until people are asking me about it. Physician's assistants, they need a certain required of hands-on hours, and being a CNA will fulfill that requirement. However, they're trying to go to school, and they need a summer program that is going to start after they're out of school and end before they need to go back to school. And trying to again be a good community member, we're going to trial this program this summer in that fashion to also meet some of those people's needs. So you can absolutely be if you're from another entity and they send them to us, normally the entity pays them while they're there. So that's great for them. If you're just completely from the public and you said, I want to be in a CNA program, I explained to them it's completely free. We've had people from the public apply halfway through, and we've hired them on halfway through the course so that they are getting paid, when they're here for the course. Some people, it doesn't make sense for them if they're going off to school and they're going to be further away.
Yes.
So with the CNA class, if they're in high school, don't they have to be 18 years old, or what is the limit on that? How old can they be if they work for, assisted living home?
So the state of Maine, for someone to be in a CNA course, they have to be 16. So if you think of many of our high schools have CNA courses. So those are juniors and seniors going through that program. So that some high schools, have that, in our area. We have those students that come in and do clinical with us. So I had one summer a CNA, and she was under the age of 18, and she went through our program. If she was working for us, which she was, we then just need to be mindful of, the labor laws and what she can work.
That's amazing.
And that's why Sadie was able to complete the CNA course, the student that I was speaking about that didn't have the high school equivalency diploma. Any other questions? Yes, do you want the mic?
I think I can.
Okay.
Do you, and this is a question for you,
Yes.
because it has more to do with adult ed. What about emergency medical services? Do adult education centers offer like EMT courses?
So off the top of my head, I'm not sure of any that do specifically, but was it you and I that were just talking about this? Desiree and I might offer that. No, we were actually just talking about this a couple of weeks ago because there is such a shortage. So it's something that I'm personally going to be looking into because we know that there's a need. Erin.
I'm just going to plug for when the funding that you're using now goes away. We owe a Workforce Innovation and Opportunity Act. The one
Never heard of it. I'm just kidding. I'm just kidding.
It can pay for training. It can pay for other support services. even in the training that you're in, if they qualify for WIOA, we can buy them scrubs, we can buy them shoes, the stethoscope, the blood pressure cup, their childcare, transportation. So it's a wonderful program that for some reason people don't know that much about it. But anyway.
And I do know about Erin's program. I work with her very closely. We're on a committee together. I'm just giving her a hard time. Any other questions? Yes.
Is the government funding that you're currently receiving, does that cover the cost of their hourly wage while they're in the course? No. So you're paying, the employers are paying that. Okay.
So, and some of the funding that we're receiving, and where I said KVCC is buying seats, so they're paying, do they pay you for the course, or they just pay for the student seat?
They reimburse the cost.
So
but
that's,
not wages.
but not
Not
wages.
included in that. It's books, training hours.
Scrubs too, right?
They do scrubs.
Yep.
When you say training hours, though, you mean the cost of the training, not they're sitting in the seat to take the training?
Correct.
The cost of the training.
Any other questions? How are we for time? I'm scared to ask.
2:32.
Perfect.
Here is our contact information. Oh, you can't really see our email addresses because they turned blue. Let me change them back to white for you all, just so you can have our contact information. Can I edit it? There we go. No, that's not what I want. Home. Where's the letters?
I think it was that one, isn't it? Or is that a Phil? Oh, wait, hang on. Can I have a trust me?
Yeah. Thank you. Yes. Thank you all so much for attending our breakout session. And here are our email addresses. And we also have business cards up front if anyone's interested. Thank you.